Medical Revalidation of Puerto Rico, DNR, Do Not Resuscitate Order. Clinical question. A 75-year-old patient with a signed and legally valid Do Not Resuscitate DNR order is admitted to the hospital for complications of heart failure. During the hospital stay, the family members insist on revoking the DNR and request full resuscitation measures. What should the physician do? A. Follow the family's wishes and initiate full resuscitation if needed. B. Reassess the patient's capacity and ask if they still want the DNR. C. Explain to the family that the DNR order is legally binding and must be honored. Consult the Hospital Ethics Committee for guidance before proceeding. Correct answer, C. Explain to the family that the DNR order is legally binding and must be honored. Explanation. A DNR, Do Not Resuscitate, order is a legally binding document signed by the patient or their legal surrogate if the patient lacks capacity. Family members cannot revoke a patient's autonomous decision unless there is evidence that the DNR order is invalid, e.g., improperly executed. The patient has changed their mind and is currently capable of making decisions. In this case, since the patient has already signed a valid DNR, the physician must respect the patient's autonomy and follow the DNR directive. Ethical and legal principles support this decision, as the right to refuse resuscitation is a fundamental patient right. If the family is distressed, the physician should provide compassionate communication and explain that the DNR reflects the patient's own wishes. Offer emotional support and involve hospital palliative care if needed. Only consult ethics or legal teams if there is a dispute over the validity of the DNR. Why not the other options? A. Follow the family's wishes and initiate full resuscitation if needed. Incorrect. This would violate the patient's autonomy and is not legally or ethically justified. B. Reassess the patient's capacity and ask if they still want. Incorrect. This is only necessary if the patient is conscious and able to make decisions. If the patient lacks capacity, the DNR remains in effect unless a legally authorized representative revokes it. D. Consult the Hospital Ethics Committee for guidance before proceeding. Correct. Ethics consultation is only necessary in cases of unclear or disputed orders. Here, the DNR is valid and must be followed without delay. Key takeaways for the Medical Revalidation of Puerto Rico exam. A legally valid DNR must always be respected, regardless of family objections. Patient autonomy is a fundamental ethical and legal principle in medical practice. Family distress should be addressed with clear communication and emotional support. Ethics or legal teams should only be involved if there is a dispute over the validity of the DNR. This question tests ethical and legal principles in end-of-life care, a high-yield topic for the Medical Revalidation of Puerto Rico exam.